New interesting paper just published in JAMA, August 2021, on the trends in consumption of ultra-processed foods in children and teenagers. Amazing. As you can see here, in 1991, the consumption, the energy from ultra-processed food as a percentage was already at 61.4% in children 12 to 19 years old. And it has increased further, reaching 67% of all the energy consumed on a daily basis. 67% of calories are from junk food. And even in kids, as you can see here, 2 to 5 years old, and in 6 to 11 years old, similar trend in a huge increase in consumption in junk, ultra-processed, refined, and processed food. Now, as I wrote in my book, you know, these processed food can be defined as industrial foods, often modified by chemical process with many synthetic additives that are assembled into ready-to-eat or ready-to-heat hyper-palatable food and drink products. These ultra-processed food typically contains refined flours, partially hydrogenated fats, high fructose corn syrup, sucrose, or artificial sweeteners, and some of them lots of salt, together with a range of preservatives, artificial flavors, colors, and cosmetic additives. Examples of these ultra-processed food, because it's important to know what we are talking about, are mass-produced packaged breads and buns, sweet and savory packaged snacks, industrialized confectionery and desserts, sodas and sweetened drinks, meatball, poultry and fish nuggets, and other reconstituted meat products transformed with the addition of preservatives and salt, nitrates, instant noodles and soups, frozen or shelf-stable ready meals, and many other food products made mostly or entirely from sugar, oils, and fats, and other substances not commonly used in a typical culinary preparation. In the same paper, in JAMA, strikingly, the ready-to-heat and ready-to-eat mixed dishes increased from 2.2% in 1999 to 11.2% in 2018, and the sweet snacks and sweets increased from 10.7% to 12.9%. Amazing, appalling. In contrast, the already low intake of unprocessed food and minimally processed food, that was 28.8%, basically 29%, declined to 23.5%, basically less than a quarter of the total energy consumed was due to this very healthy, colorful vitamins and fiber and phytochemicals and minerals rich food that everybody should eat if you want to stay healthy. Instead of, you should get rid of junk food. And also you should reduce the consumption of animal products. As you can see here, beef consumption increased big ways. And you see first McDonald's restaurant opened in before 1950, 1,000 in 1970. There has been a huge increase in the consumption of chicken, fish and shellfish, turkey and lamb and other animal products that have an impact not only on human health but also on environmental health, a big component on environmental health. Now, As you can see here, potato chips, potato fries, potato meats, processed meats, unprocessed red meat, butter, sweet and desserts, refined grains, they're all associated with a weight gain. In contrast, vegetable, nuts, whole grain, fruits, and yogurt are associated with weight loss. And sugar sweetened beverages and fruit juice are also associated with an increased risk of obesity and weight gain in both men and women and in kids. Now, of course, these are epidemiological studies, but well-conducted randomized clinical trial like this one published in Cell Metabolism by Kevin Hall from NIH shows basically that that in 20 weight-stable young non-obese individuals were randomized to either consuming an ultra-processed or an unprocessed diet for 2 weeks, followed by the alternate diet for another 2 weeks. So it was a crossover study. The two diets were designed to contain the same amount of calories, macronutrients, sugar, sodium, and fiber. And the volunteers were instructed to consume as much or as little as desired. The results of this very well done study is that people who ate the ultra-processed diet consume on average 510 kilocalories per day more and gain about 1 kilo in only 2 weeks. 1 kilo in 2 weeks, meaning 2 kilos per month, meaning basically 24 kilos in a year. While the people who consumed the unprocessed food lost, not gained, but lost 1 kilo of body weight in 14 days, okay? Now, this epidemic of obesity in children and teenagers, that is, as you can see, it's a pandemic, is a pandemic because not only in US has increased from 15% of overweight children in 1972 to 35% now, but in many other countries, Mexico, Brazil, Iran, South Africa, Hong Kong, China, there has been, you see, a huge rapid increase in children obesity. Now, as I discussed in a previous video few days ago, that there is a paper just published in New England Journal of Medicine showing that in young onset, in basically teenagers, the young adults with young onset type 2 diabetes, the consequences are huge. So let me explain. If you are overweight and obese when you are a child or a teenager, your risk of developing type 2 diabetes in young adulthood is very, very high. And if you have type 2 diabetes in young adulthood, like in this study, you see these people, they were studied when they were 26 years old and they already had type 2 diabetes, and they have been followed for 13 years, okay? So basically at the end of the study, they were 39, 40 years old. The result is that only after 13 years of diabetes, 67% of them had developed hypertension. That is a major risk factor for coronary heart disease, heart failure, stroke, and many other clinical conditions. 52% they had dyslipidemia, and 55% they had chronic diabetic nephropathy, leading to dialysis and eventually kidney transplantation, meaning unsustainable financially. And 32% had diabetic neuropathy, and 50% had diabetic retinopathy, leading to blindness. This is a disaster, okay? And not only these ultra-processed food, as I wrote in my book, are bad because they increase the risk of becoming obese and having type 2 insulin-resistant type 2 diabetes and all the complications in terms of cancer, dementia, cardiovascular disease, liver disease, and many other ones because of the anti-calories. But also they are reaching saturated fatty acids and trans fatty acids. They are also increasing hypercholesterolemia, a major risk factor for cardiovascular disease. They are very rich in salt, that is a major risk factor for hypertension and stomach cancer. And they have added sugars and high fructose, major risk factor for, again, insulin-resistant type 2 diabetes, obesity. They are very low in vegetable fiber, vitamins, and phytochemicals. They may contain high level of potentially carcinogenic molecules, including those here, you know, heterocycloamines, acrylamide, and polycyclic aromatic hydrocarbons. They may contain food additives that are controversial, like sodium nitrate that in processed meat has been associated with increased risk of colon cancer, titanium dioxide, there is a whitening agent, talc and carbon black, and many other ones. And then many of these foods, they come in packages with material that can release carcinogenic and endocrine disruptors like BPA and others into the food. So please stay away from this very bad food. You should eliminate this food from your diet, and especially the diet from your children. Is bad for your health. Also because, as I said, you know, this food is very low in fibers and soluble fibers. And as we have shown, this has huge effect in changing the gut microbiota composition, the gut microbiome, and the metabolism of these bacteria, leading to immune dysfunction, inflammation, and many other autoimmune, allergic disease, and other conditions that we are still studying. But, you know, the data are really strongly suggesting that, you know, the gut microbiome has important effect on metabolic health, and these ultra-processed foods are deeply altering the gut microbiome. And there are studies recently in 2019, there have been 3 papers published in BMJ showing that even small consumption of ultra-processed food is associated with increased risk of mortality and higher probability of developing heart disease, stroke, and cancer, in particular breast cancer and colon cancer. Mortality increased by 18% for each additional serving of these ultra-processed food. Okay? So there is lots of data that are suggesting that this is bad for health, and this is causing a series of metabolic molecular alterations. Of course, it's not the only one, but it's a major player, you know, with other unhealthy food. The displacement of real food, minimally processed food, plant-based, and fish, you know, with this ultra processed and a lot of animal products, especially this processed meat, is causing a lot of issues. And as we wrote in this perspective study in PLOS Medicine, these unhealthy food and lifestyles are terrible and are financially and environmentally unsustainable. So waiting for millions of people who eat unhealthy food and engage in harmful lifestyles to end up in outpatient clinics and hospitals with symptoms of chronic disease that, as again, you know, if you're consuming this food, they're gonna come. It's almost guaranteed that they're gonna develop. We think it's unethical, financial, environmentally unsustainable. Don't you think that it would be better if we taught people from an early age what they need to do to maintain their health, and how nutrition, exercise, and other lifestyle intervention work in reducing the accumulation of damage leading to multiple chronic disease? Therefore, I think it's important to really work hard to integrate, to develop a CV, a health literacy CV as soon as possible, starting in primary school, secondary school, university, colleges, where we teach how these food, what are the mechanisms. People know that, that certain food are bad, and, sedentary lifestyle, alcohol, but they don't understand the mechanism. And we have a much deeper understanding of why they are bad. And if we could explain since childhood why consuming this food is bad and what happens within your body when you eat this food, probably people, they're going to slowly change their behaviors. And another important concept, we discuss in PLOS Medicine in this paper, is that we think that full accounting should become the basis of policy, ethics, and actions. The real costs of the effects of this ultra-processed food, of excessive animal food consumption, and of these dysfunctional agricultural systems are largely unmeasured and have little or no impact on producers, but also on the choices of the consumers about production, distribution, and consumption of goods. Instead of both the producers and in some way also the people who are consuming, they should pay for the real cost, the social cost, the healthcare cost, the environmental cost of these super unhealthy and toxic food. And we should also try to change laws and make healthy foods more affordable than less healthy ultra-processed food, because this is gonna not only improve health, but it's also gonna reduce health inequality, because right now this ultra-processed food is super cheap, and so people, they may buy this food for other reasons, for economic reasons, and this is increasing health inequality. And we should also have some strategies to restrict advertising of these ultra-processed food to children, implement in front of package nutrient labels, and enhancing food quality in schools. And I think, we should also lower taxes and health insurance premiums for people with healthy lifestyle, and taxing not only carb, but also animal ultra-processed food and beverages. So here there are, if you can follow basically some of my videos if you want, if you're interested in these topics on YouTube. I post regularly articles that I think are interesting, or my own articles and publications on Twitter, LinkedIn, and Facebook. And as always, thank you for listening, and we'll be together soon with another interesting video. Thank you.